Tuberculosis TB is a potentially serious infectious disease caused by the bacterium Mycobacterium tuberculosis. TB primarily affects the lungs but can also affect other parts of the body, such as the kidneys, spine, and brain. It spreads through airborne droplets when an infected person coughs or sneezes, making it highly contagious. Types of tuberculosis TB can exist in two forms. Latent TB. In this form, the bacteria are present in the body but inactive, so there are no symptoms. People with latent TB cannot spread the disease, but the infection can become active, particularly if the immune system becomes weakened. Active TB. This is when the TB bacteria are actively multiplying, causing symptoms and potentially allowing transmission to others. Active TB can develop shortly after infection or years later if immunity declines. Symptoms of tuberculosis. Symptoms vary depending on the organs affected but are generally related to the respiratory system when the lungs are involved. Common symptoms of pulmonary lung TB include persistent cough, lasting more than 3 weeks, often producing mucus or blood, chest pain, often with breathing or coughing, fatigue and weakness, fever and night sweats, loss of appetite and unintended weight loss. If TB affects other areas like the spine or kidneys, symptoms will relate to those areas, e.g., back pain in spinal TB. Causes and transmission of TB. TB is caused by Mycobacterium tuberculosis, the bacteria that spreads through the air. Common ways it spreads include coughing or sneezing, when someone with active TB in their lungs releases droplets into the air. Prolonged exposure. Usually, brief exposure is not enough to transmit TB. It typically spreads through prolonged contact in close quarters. Individuals with weakened immune systems such as those with HIV/AIDS, diabetes, or malnutrition are at higher risk of contracting TB. Risk factors for tuberculosis. Some factors that increase the risk of contracting TB include living or working in high-risk settings, hospitals, prisons, or refugee camps where TB is common. Weakened immune system. Conditions like HIV, diabetes, or certain medications, e.g., immunosuppressants, reduce the immune response. Traveling or living in areas with high TB rates. Countries with a high prevalence of TB pose a higher risk of infection. Diagnosis of tuberculosis. Diagnosing TB involves various tests. Tuberculin skin test (TST), also known as a Mantoux test. It involves injecting a small amount of tuberculin into the skin. If a hard, raised bump develops within 48 to 72 hours, it may indicate TB infection. Interferon gamma release assays (IGRAs), blood tests such as the QuantiFERON TB Gold test that measure the immune response to TB proteins, often used for people with a history of the BCG vaccine. Chest X-ray, a common imaging test to look for signs of active TB in the lungs. Sputum test, analyzing sputum mucus from the lungs under a microscope to detect TB bacteria. This is critical for confirming active TB. Additional tests. In cases of extrapulmonary TB, MRI, CT scans, or biopsies may be necessary for diagnosis. Treatment for tuberculosis TB is curable with a regimen of antibiotics, although treatment can take 6 months or more. Key components of treatment include first-line antibiotics. For drug-sensitive TB, the treatment typically includes 4 primary antibiotics: isoniazid INH, rifampin, rifetambutal, BMB, pyrazinamide, PZ. These are usually taken for 6 to 9 months, although the exact duration depends on the case. Directly observed therapy. To ensure adherence, healthcare provider may observe patients taking their medications, which helps prevent incomplete treatment and antibiotic resistance. Drug-resistant TB. For cases resistant to common antibiotics, more advanced treatments are required. Drug-resistant TB, including MDR TB, multi-drug-resistant TB, and XDR TB. Extensively drug-resistant TB involves stronger, second-line drugs, often with more side effects and longer treatment duration up to 2 years or more. Prevention of tuberculosis vaccination. The Bacillus calmette guarantee CG vaccine provides some protection, especially for young children, but is not widely used in countries with low TB rates. Infection control in healthcare settings. Hospitals use practices such as ventilation, isolation of TB patients, and masks to prevent spread. Screening and early detection. Regular testing in high-risk populations helps identify latent or active TB early, enabling treatment before it spreads. Complications of tuberculosis. Untreated or poorly managed TB can lead to serious health problems, including permanent lung damage, scarring, and reduced lung function can result from prolonged or severe pulmonary TB. Extrapulmonary TB complications. TB outside the lungs can affect the kidneys, spine, or brain, leading to meningitis, bone infections, or kidney issues. Increased risk of death. If untreated, TB can be fatal, particularly in those with weakened immune systems. Living with and managing tuberculosis. Complete the full course of treatment. This is crucial to curing TB and preventing relapse or resistance. Regular follow-up appointments. These are needed to monitor side effects, assess response to treatment, and make any necessary adjustments. Support networks. Managing TB, especially drug-resistant types, can be physically and emotionally challenging, and support groups or counseling may be beneficial. Prognosis. With early diagnosis and treatment, the prognosis for TB is generally favorable, although it can be more challenging in drug-resistant cases.